Hello. So, September is National Recovery Month. So, today I thought that I would talk about addiction and if it's really a disease or not. So, I am a licensed addiction counselor. My opinion and the facts and the science behind it show that it is an addiction. I know a lot of people are still kind of on the fence. They're like, no, it's a choice. Like, people choose to do that. And when you think of a disease, you think of heart disease or cancer or diabetes, things like that, those really chronic diseases. But now science is showing that addiction is a chronic disease. So there are things that make addiction parallel to other diseases. So that's what kind of I wanted to talk about today. So a disease is a disorder of in a human or animal or plant, especially one that produces specific signs or symptoms that affect a location, and it's not simply because of an injury. So basically what that is saying is that there is something that has to have a dysfunction, and then it has to cause signs and symptoms. So for example, in diabetes, the structure that is impaired is the pancreas. So then insulin is not being produced like it should, and then it causes the symptoms that you see in a diabetic, the drop in blood sugar or the really high blood sugars, and then all of the problems that kind of encompass that. So in addiction, instead of the pancreas being affected, it's the brain. So drugs interfere with the way that neurons send and receive messages. So basically what happens is the drug will trick your brain into thinking that the drug is the most important thing, even more important than sleep, sex, food, spending time with your family, having a job, even taking care of your kids. So your brain really does think that the drug is the most important thing, and then you see the symptoms in someone who's addicted of the lying, stealing, cheating, sneaking around, trying to hide stuff, not going to work, sleeping all the time, staying up all night, those things that really do hurt the family as a whole. So those are kind of what makes the addiction an actual disease instead of just a choice. And I hear a lot that, well, people don't choose to get diabetes. And that's true. Nobody chooses to get diabetes or to get cancer or to get heart disease. But nobody chooses to become addicted either. So a lot of people say the difference is that, the addicts made poor choices. But if you look at other things, like, yes, they did make poor decisions, but at the same time, some people with diabetes, they didn't pay attention to their diet. They didn't pay attention to exercising. People who get cancer, if it's skin cancer, maybe they used to tan a lot. Maybe they, didn't wear protective sunscreen. People who get lung cancer, maybe they smoked. Maybe they had a job that, that wasn't healthy for them to be breathing the air that was in their workplace. So a lot of that is just kind of putting that into perspective. So of course people don't choose to be addicted, but when they start, their first choice is, maybe having a cigarette, maybe having a drink of whatever type of alcohol, taking a hit of weed. How many of you guys can say that you've never done any of those things? So if a person is already predisposed to becoming addicted, one cigarette or one drink or one hit of weed can really be that deciding factor on whether or not they become addicted or not. So that is something else to keep in mind. So the way that addiction starts really is innocent most of the time. Nobody, when they're little, nobody grows up and it's like, oh, I want to be an IV drug user. No, it happens, by first, maybe even by smoking a cigarette. Everyone says, not everyone, but a lot of people, say that that marijuana is a gateway drug. But I've also heard the argument that tobacco is a bigger gateway drug than marijuana. So a lot of times it really does start out as something innocent, or, just maybe trying to be a little bit rebellious and, smoking a cigarette or something like that. And I really think that the only way that addicts are going to get help is when they don't feel embarrassed to ask for it. So the more that everyone can talk about it and be educated on it and realize that it is a disease, and just to lower that stigma, can give people who are active in their addiction a chance at recovery. So I would encourage you, if you know someone who is struggling with addiction, and you don't have to go through it to be able to understand what they're going through. Like, of course, you're not going to know all the details and, the really raw feelings. But if you come at it from a perspective like, hey, I realize that this isn't you making these decisions, it's your disease. And to just lower that stigma so that they feel like they can ask for help. They feel like they can go and get help. And another thing you can do is, especially in September, there are a lot of events going on. I know, like in my local area, we are having a recovery walk next month. And there's also like a 5K run, to just help support people in recovery, and then also to lower stigma. There's going to be different speakers and food and things like that. So I would encourage you to look around your area and find activities like that and really, get involved. And really do your part in lowering that stigma so that people feel like they can get help. The other thing, if you want more information on this, there's a really good documentary. It's called Pleasure Unwoven. I will post it in the comments, but you can get them on YouTube. It's not the whole documentary, but it's like bits and pieces of it. It's about a doctor who also is a former addict, and he he lays it out really well, the differences between like the choice and addiction actually being a disease. So it's really good. So I would really encourage you guys to check that out. If you have any questions, please let me know, and please subscribe to my channel. Thanks, guys.